Hello and welcome to Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. In this episode, you'll get important health advice from local medical practitioners, including tips for navigating the holiday buffet table. We'll show you how to incorporate healthy eating. A local woman shares how she's living a life she's always dreamed of thanks to a procedure to alleviate arthritis pain. And a local hospital receives national recognition again for patient safety. But first, we want to tell you why Florida Hospital Waterman's surgical program is in the national spotlight. The hospital is one of only 44 nationwide and the only one in Central Florida to be recognized for meritorious outcomes in surgical patient care. The hospital participates in the American College of Surgeons National Quality Improvement Program, which recently recognized Florida Hospital Waterman for its improvements in outcomes in patients who had colorectal surgery.
The American College of Surgeons, through their NSQIP program, which is the National Improvement Surgical Quality Program, comes up with best practices from a global standpoint. We take best practices for patient care from all over the world that have been proven to improve outcomes. From being a part of this program, almost everything that we've done to improve our colorectal surgery, we've taken over into other kinds of surgeries. We put all those practices together through teams that we form through the hospital, and we work together as a team to put these best practices into place so that we can, before, during, and after surgery, decrease bad outcomes and increase good outcomes.
Over 550 hospitals participate in the National Surgical Quality Improvement Program. And here's another reason Lake County residents should feel at ease with their local health provider. Florida Hospital Waterman remains Lake County's only A-rated hospital for patient safety. The hospital received the grade for the third year in a row from an independent industry watchdog. The Leapfrog Hospital Safety Score uses 28 measures to grade a hospital's efforts to protect patients from errors, injuries, and infections. Only 31% of the more than 2,500 U.S. general hospitals reviewed received the A rating. A strong medical system is reliant on support from the community. Lake County is fortunate to have many who are dedicated to elevating medical care in order to meet residents' needs. Sometimes that community show of support is generated with fun. Recently, the Florida Hospital Waterman Foundation held its 21st annual Partners in Healthcare Golf Classic. Area business leaders, physicians, and other members of the community participated in the event. This year's golf tournament raised money for heart care services at Florida Hospital Waterman.
Overall, the foundation has actually raised close to $5 million for the Heart Center, which is a substantial amount. Those dollars have gone into continue to elevate our open heart program, our cath labs, our entire process, our training, everything associated with the Heart Center to continue to elevate that care that we have. And the care doesn't start necessarily right at the hospital. It starts in the community when the EMS actually picks up the patient and we transmit EKGs to the hospital. The ED actually reads it before the patient shows up. They trigger different teams to be there and ready for the patient when they arrive.
Patient care is not just within the confines of a hospital. The community at whole in public health is best served by the patient, number one, taking care of themselves at home. But also pre-hospital, we rely heavily on our physicians in the community, and we have a great established network of physicians here in the Waterman area.
These fundraising efforts are extremely effective. Florida Hospital Waterman recently completed extensive enhancements to its second catheter lab, which offers state-of-the-art diagnosis and treatment of cardiac patients. We now turn our focus to a painful condition that affects many in our community. More than 50 million Americans suffer from arthritis. Many notice increased discomfort when the weather changes to cooler temperatures. And while arthritis can take many forms, the outcome of living with it is often the same for all sufferers.
Well, arthritis can be crippling, disabling, depressing, especially when it's involving the weight-bearing joints. If their lifestyle is being altered to that degree, what typically happens is they become less and less active. As they become less and less active, of course, they're sitting and riding instead of walking, standing. The rest of their body gets in worse shape, not just the rest of the joints and their musculoskeletal system, but their cardiovascular system, everything starts to get worse.
Dawn Roberts of Bellevue can attest to that. She suffered from arthritis in her left knee and said it truly impacted her quality of life.
I was having problems with arthritis and just pain, a lot of pain. And when they looked at the MRI and the x-rays, the left part of my left knee was in really good shape. And the right part of my knee, which is on the inside, was a medical disaster. There was basically rubbing bone on bone.
In September 2013, Dr. Radnothy performed partial knee replacement surgery on Roberts.
Now with our knee replacements, partial knee replacements, we do these femoral nerve catheters where the anesthesiologist puts this little catheter over the big nerve that goes into their thigh that supplies pain to their knee, and we're able to quite often completely eliminate the pain, the post-op pain, those first 48 hours. And when you're able to do these smaller incision surgeries like this, you're eliminating blood loss, you're reducing soft tissue damage, you're being able to get them up and going much quicker, combined with the better ways that we're able to control pain nowadays. Ultimately it just leads to a more quicker return to normal function.
And I was on a walker to start, and then on a cane, and then finally to nothing. I never thought that I'd be able to have my life back like I have. And the biggest thing is going out with my husband to go out to dinner, and I used to have him help me up to get out of a booth or a chair or something, and going out for the first time and not having him help me up. That was like, I could have had my own little party right there.
To learn more about options for your joint pain, plan to attend this upcoming free seminar. You'll find details at fhwatermanortho.com. There is more to come after Waterman Wellness takes a short break. With so many delicious temptations during the holiday season, how do you make healthy choices? Plus, a Tavares pediatrician has advice for patients to help identify which foods may cause health problems for their children. And we'll introduce you to a fun way to make a satisfying meal or snack, and it's good for your heart. First, Waterman Wellness has information about community events and classes that can contribute to your healthy lifestyle. We'll be right back. Welcome back to Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. The holiday season is a time to celebrate with family, friends, and coworkers. Those gatherings, however, are often filled with temptations that may interfere with your attempts to maintain a healthy lifestyle. According to family practitioner Veronica Chastain, the first step is identifying the lifestyle changes you need to make.
Not only explain to them diet, but also give them guidelines as to how they can start a dietary plan that can help improve their condition. One of the most studied diets is called DASH diet. It has been proven to decrease blood pressure and also increase the good cholesterol, which is cardioprotective. It's very important to set small goals, and then as we continue advancing, maybe add a little bit further goals. And that will give us also positive reinforcement that if we are able to achieve those little goals, we certainly will get to our major goal.
Dr. Chastain says the decision to adopt a healthy lifestyle should be a family affair.
Well, we always are open for the patients to bring the family members with them. Sometimes it's a little bit difficult because the patient may have different preference, but we're always open, and a lot of times most of this counseling works better when we have family members close by, because if they can also engage in those lifestyle modifications, likelihood is that the patient will continue doing them. and be successful at it.
So, when faced with the sweets and rich foods that seem so abundant during the holiday season, how can you treat yourself and still reach your goals?
So in terms of indulgences, again, it's all about the portion, and it's all, what the moderation is a definition that is different for every single patient that we ever see. Dark chocolate that's supposed to be a high potential antioxidant should be used in moderation. You're supposed to have a daily amount, and I'm not sure if it should be 1 or 2 ounces, but suffice it to say that the darker the chocolate with the least sugar, it should be the healthiest one. Same thing with nuts. Nuts are an incredibly healthy, maybe to some people it's an indulgence, to other individuals that may not be, but things that are healthy for you. But still, you can have some nuts and be preventive. You can't eat a pound of nuts because they do have fat, and then you would gain weight.
Weight gain isn't the only concern from holiday festivities. For some, the baked goods and rich, heavy foods on the buffet can prompt allergic reactions. An estimated 15 million Americans, many of them children, have food allergies. In extreme cases, the allergic reactions can be deadly. 8 foods account for 90% of all food allergic reactions. They are peanuts, tree nuts, milk, eggs, wheat, soy, fish, and shellfish. And these are popular ingredients on a holiday buffet.
The difficulty with food allergies is often symptoms that accompany food may not necessarily be due to an allergic reaction, may be due to other things. For example, it could be a chemical reaction. There are some fruits, highly acidic fruits, that can cause a rash or an irritation around the mouth or in the mouth that isn't due to an allergy, it's due to the acid in the fruit. There are some fruits, if you eat fresh fruit, it may be the pollen that's on the fresh fruit that you're reacting to, but not the fruit itself.
Dr. Diaz says it's important for parents to figure out what symptoms a child experiences and to see if there is an apparent trigger.
True food allergies, meaning it's due to an allergic reaction, should be immediate, soon after eating that food. There are other types of reactions that may not necessarily be allergic that may happen hours or days later. We have to separate an allergy to a food versus a sensitivity to a food or an inability to digest that food, and that's where celiac disease or celiac sensitivity comes in. So parents report that their child's symptoms get better after discontinuing gluten in their diet. Well, that may be due to other things in those same foods that they may have been sensitive to. Celiac disease or true gluten intolerance can be a very severe disorder, but it has to do with the way that the intestines process that protein in certain grains. But the important thing is to look at the symptoms that the child is presenting with, looking at the different possible triggers for that. Often we don't eat the healthy things that we should, so lots of fruits and vegetables, whole grains if you tolerate them, lean meats, and plenty of water are always going to be a good recipe for everyone.
Need a medical expert to help you with your lifestyle and nutritional needs? Visit fhwaterman.com or call 352-253-3635. Wouldn't it be great to actually eat all of those healthy foods doctors prescribe and still satisfy your sweet tooth? We head to the Connery Creation Health Kitchen now for a tasty holiday dessert that you won't feel guilty about enjoying. 'Tis the season for holiday parties, and when you think of those holiday parties, you think of sweets being on the menu. Well, we have registered dietitian Stephanie Bassett and Florida Hospital Waterman executive chef Dave Atkinson here to show us a treat that not only is delicious, but is actually good for you and will still be the hit of the party. So what are we making?
We are making little apple pie tartlets.
Ooh, and how is this good for us?
It has way less sugar than normal apple pie, and it's way lower in calories than regular apple pie. So it's a healthier alternative to your traditional dessert.
Okay, so Chef Dave, what is going into this lovely dessert?
Well, for our apple filling, we're going to cook some fresh apples, water, sugar, and cinnamon together.
Okay.
And then for our crust, we have rolled oats, brown sugar, flour, butter, cinnamon, and nutmeg.
Ooh, sounds delicious.
We're going to let this cook just for about 5 minutes or so, just until the apples start to soften, so they don't have to cook as much in the oven. And for the crust, All these ingredients just go in the food processor, and we're going to pulse it just until we have a crumbly mixture.
It already smells like the holidays in here just because of the apples and the cinnamon.
Okay, so we have our crumbly mixture now, and we're just going to press this into a mini muffin pan.
Cinnamon's good for blood sugar, right?
There are some preliminary studies that show that it is helpful in blood sugar control, but there's no definitive evidence showing that yet, so we might be on the way there, just not quite yet.
Okay, so we're ready to go to the oven. So we're going to place these in a 350-degree oven for about 15 minutes, or until they're golden brown. And here we go, our nice mini apple tarts.
Gotta love those non-stick pans.
Yeah. And you could put a little whipped cream on them if you'd like.
So delicious! If you'd like the recipe for the apple pie tartlets, visit watermanwellness.com. How would you like to get good nutrition and a workout in one fell swoop? This Smoothie Bike makes healthy eating and exercise fun. Recently, Florida Hospital Waterman employees got a chance to give it a test ride. Riders add their favorite ingredients into the blender and then provide the pedal power to make a fresh smoothie. Waterman Wellness's own registered dietitian Stephanie Bassett stepped out of the kitchen to explain why a smoothie is a great option for people on the go.
Smoothies are a great alternative to a meal or a snack because they promote more fruit and vegetable consumption that you may normally get, and they're very easy to make. You can use them with very easily found ingredients that you may have at home. So what you do is you hop on the bike, you pedal for about a minute or so, and it makes a wonderful smoothie, so it incorporates physical activity and healthy eating together.
Check out watermanwellness.com for dates and times when you can ride the Smoothie Bike at the hospital or at community events. You'll find Stephanie's suggestions for some delicious smoothie recipes that you can make at home. We hope you've enjoyed this month's Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the January episode right here on Lake Sumter TV for some of the following stories. When is the best time to think about putting your health in the hands of someone who specializes in senior care? You'll want to tune in next month. A local urologist will share insight into an often embarrassing condition that affects millions of Americans, young and old. And it's hearty, it's healthy, and it can be a delicious substitute for potatoes. We'll visit the Conry Creation Health Center kitchen for a recipe using a versatile vegetable. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for Waterman Wellness.